Well, doctors in the Bay Area and all across the country are noticing a new coronavirus symptom. They're calling it COVID toes. They're dark lesions on the feet that may indicate a person has been infected with coronavirus.
And a warning about the medical photos we're about to show you. KPIX5's Kenny Choi talked to Bay Area doctors to find out what else they're seeing.
Many questions about whether this is a telltale symptom of the virus. Medical experts saying that it's unusual, though, that they're seeing so many cases of these red and purple toes just as the weather is starting to warm up. Swollen, inflamed, and puffy red toes are common when exposed to cold and damp conditions, but doctors are noticing a spike at the wrong time.
Honestly, in the past 2 weeks, I've seen more toes in my clinic than I have in the rest of my career.
That we are seeing something that we believe is a real trend, and that tells us about the prevalence of infection in our communities.
What's unclear is when these lesions might appear if someone has been exposed to coronavirus.
We are seeing some reports that patients are developing these toe lesions at the same time as they're developing other COVID symptoms. Some patients seem to be completely asymptomatic except for the toe lesions, and yet other patients are developing the toe lesions what seems like maybe a month after they've been infected.
If doctors or family members were to see this, then with the information we have now, I would go and get testing for COVID.
So it's actually quite reassuring, and I think that's very important that people understand that if they do have the skin finding, most likely it means that their body has seen COVID and is in the recovery phase.
Federal health officials do not include toe lesions in the list of coronavirus symptoms.
I think the really important public health message is not to panic. Most of the patients that we're seeing with these pernio-like lesions or these purple lesions of their toes or these COVID toes are really doing extremely well.
Doctors say that those who are getting it tend to be young and healthy. They do not recommend going to the emergency room, but to contact your doctor or dermatologist and to be aware that you could be infectious. In San Francisco, Kenny Choi, KPIX5.
There was